Morning, everyone. Welcome back to Advice from the Ice.
Oh yeah.
Today, we're going to talk about physical concerns in the medical industry because we get a lot of questions about, like, well, I have a heart condition. Should I do this? I have autoimmune. Should I do this? Things like that. And first of all, I'd like to re-elaborate that we are not doctors or scientists. So if you have any medical concerns, absolutely ask your doctor before you start getting into cold water and make sure it's going to be okay for you.
Exactly. And like Rose has mentioned before, some doctors aren't even for this practice. This actually, a little side story. I had a friend who was staying in Alaska, and she had a injury happen to her neck, and she wanted to just get in the cold water of Alaska and let that help. She did do that, but she was kind of getting a little fearful of it. So she went to the doctors, and the doctor had pretty much no idea like what she was talking about, and kind of made her like feel like she shouldn't be doing it kind of scenario. So there are people that may live in certain areas where doctors just aren't even open and receptive to this practice. So that's why it's great to track your own progress and ease your way into this practice so you can find out for yourself if it's something you can be doing or not. Because our brains, we're pretty good at knowing what's good and what's not good for our own bodies if we're paying enough attention to it.
Yeah, and especially in the US, the medical industry here is very much, throw a pill at the symptom and hope it gets better. They're not really searching, for the most part, for actual cures or what's actually causing the problem. So a lot of doctors are not for cold therapy. We have another friend with severe autoimmune diseases that started doing cold therapy, and it basically cured all of them. And when she told her doctor about it, she was like, you need to recommend this to all your patients because her doctor was a specialist. And her doctor was kind of like, yeah, sure, cool, good for you. And like she realized very quickly that her doctor wasn't going to tell anyone her story. Because one, it was a single case. There was no further study behind it. But two, it didn't really, she was losing a patient essentially because this girl had cured herself. So, not saying all doctors are bad. I'm not saying all doctors are part of the big pharma system, but there are quite a number that are. So hopefully yours is good.
Definitely. But again, cold therapy has been around for a while. Cold showers, ice baths, cryotherapy, even engaging in some winter sports. I know there's people that like to do stuff that's insane, like diving under ice and swimming for long periods of time. Don't recommend that, but it's pretty incredible what people can do with their bodies. And then some historical uses of cold therapy. It's been used for years to treat injuries, reduce swelling, and manage pain. Um, Cold compression, after injury or strenuous workouts. But only now we're kind of seeing scientists get more data on curing autoimmune diseases or certain medical conditions that people have. But that's why I feel it's so important because the pool of the cold therapy community is still so small. So the more we engage with each other and learn from each other, the more data we can pull from this amazing practice. Just hearing, stories of our friends curing their diseases, or me, I broke my ankle and it's healed faster than it would have taken if I wasn't doing cold therapy. Like there's just so much information we can find out from this space that hasn't been discovered yet.
Yeah, there's a lot of work going on right now with ASU. There's a couple other industries, of course. Dr. Soyberg, I believe her name is, in I think Sweden. I mean, she's, the pioneer of all this because she specifically studies cold water swimming, and she's where a lot of people like Huberman and Wim Hof get their information from. So there is studies being done, but not nearly as much as we need. And one of the problems that we've run into with the Wellness Wednesday videos is we find a lot of the studies are performed on men and not women. And so most of what we talk about in the studies is done on men or mice rather than being done on women. So we haven't really seen too much of the scientific data for women. We have a lot of allegorical when it comes to women. But there's, proof that Socrates in ancient Greece was doing cold baths. So it's not a new theme. The problem is just we've gotten so good at acclimatizing our environment to ourselves instead of the other way around, that the idea of it for a lot of people just is too much. But there's so many uses for it. Obviously, like we talk about it all the time, right? Inflammation and swelling, recovery from exercise or surgery, mental and mood clarity and boosts, and then the metabolic effect, of course, is super huge. The recharge rooms that we work with as well have found that by incorporating red light and sauna treatment with the ice bath, they're able to get the smell out, because a lot of firefighters and whatnot, after they fought a fire, like would smell of smoke for 3 days, no matter what they did. And by doing the recharge circuit, they actually go home not smelling like smoke, which means there's a very good chance that the cancer causing properties of what they're around are probably significantly dropping. So they're not only giving these guys more health, um, they're giving them more resilience. They're probably going to be able to keep them in the industry longer, and they're giving their spouses a break from the constant smoke smell. So it's pretty amazing to see like what can actually happen.
That's so incredible. I didn't even know about that smoke stuff.
Yeah, I talked to the guy a couple of weeks ago about it, and then they're going a little bit further. They're doing some sort of test. I don't remember what, but it's like doing every day or every 3 days versus once a week or something like that, just to like test if, like where the compounding effect of multiple plunges a day or multiple times, hours, minutes a week, whatever, really does for people. So
That's amazing.
yeah. Well, because part of it is like there's that whole like Andrew Huberman that came out and said like, oh, you should do 11 minutes a week, right? And he has a bit of a cult following. So people started saying like, oh, you need to, if you're not doing 11 minutes a week, it's not even worth it. And it's like, no, like if you only have access twice a week and you can only do, 4 minutes a week, and then you're doing cold showers as best you can in the summer, like it's fine. Any amount of cold therapy is going to help. So by putting that kind of a hard, like it needs to be 11 minutes or it doesn't matter, or even the 2 minute minimum, right? Like, yes, we strive for 2 minute minimum, but if you can only do a minute, that's fine. Do the minute. Because you're still going to get some kind of effect, and eventually you're going to be able to work up to it, or, you might have a schedule change. You're going to be able to do it, or the winter's going to come and you're going to be able to do cold showers every day and you're going to be fine. So this linear thinking of, well, this person said this, and so if I can't do that, then I can't do it at all, is really detrimental to a lot of people.
No, I agree. Like we always say, it's your body, your practice. So and I have some days where I don't think I go full 2 minutes. I don't run my timer. I just get in there and then get out, not even knowing like how long or whatever. I'm just happy that I went in and I just listened to my body. Like, okay, this feels good enough. It might be more than 2 minutes. Who knows? But
Right.
it provides me with the same benefits, like the mental clarity, my inflammation, everything is still being affected in a positive way. So I honestly don't really care about the duration. I just care about the cold and make sure that I'm integrating it into my life and my body in some sort of way.
Yeah. Love it. So of course they're all always concerned with the cold, right? And the first one that people always think about is frostbite, frost nip, or the one that's not thought about too much is non-visible cold injury. So this can happen, especially if you're super sensitive, you have very poor blood flow, and you're trying to keep your hands in or your toes in. We always recommend that if you're having a problem with your, fingers and toes, just pop them out or get neoprene booties or socks, whatever it looks like, because yeah, it's awesome to see people who can keep their hands in the full 2 minutes and like keep their feet in and whatnot. But if that's not you, that's fine. Non-visible cold injury can actually cause nerve damage that you don't even know about because again, it doesn't look like you've damaged everything versus frostnip where you start to see the damage and then of course frostbite where the damage is already done.
Yeah, and cardiovascular concerns. People with existing heart conditions may face risk due to cold exposure, as it can constrict your blood vessels and elevate your blood pressure. I had a friend who wanted to try ice baths, but he has what was it? Maybe kind of an irregular heartbeat. Medical condition. So I was like, okay, I don't want to take you to the hospital right now. But he put his suit on and he just stuck his legs in at least. And even just doing that, he really enjoyed it. He came out and like felt amazing. Just, you know, ease yourself into it and don't be upset or listen to the peer pressure or whatever. Like, listen to you and your needs and what feels good to you.
Yeah, we just did a Wellness Wednesday video too on heart conditions and cold therapy. And part of it is, a lot of people are on beta blockers when they have heart conditions. And you never know like how your body's going to react if you're on a beta blocker and you're getting into the cold, right? Because it's not going to react the same as if you weren't on the beta blocker. So there's lots of different things to consider. Now, obviously, a lot of people use cold therapy and ice baths to get off of medication, but that doesn't necessarily mean stop taking your beta blockers and start jumping into the cold, right? Like you might need to do it in stages. And again, this is where you can talk to your doctor and be like, hey, is this okay? Because your heart rate's going to spike when you first get in, obviously, but then it's going to come back down. But if your body's not good at regulating, or if you're on a beta blocker and it goes up and it's not getting the signals correctly, it could end very badly. So absolutely on those instances, like really check with a doctor or check with multiple doctors even. Or we recommend doctors and podcasts and whatnot of people who are actually in the cold therapy space. So you can always look up a doctor and see if they actually have looked into cold therapy at all. So you can get a maybe no idea about cold therapy or very anti-cold therapy opinion. But then you can also find the doctors that are pro ice therapy and talk to them.
Yeah, definitely. And I feel as the years go on and as we're spreading this word of cold therapy, I think 5, 10 years from now, there should be more doctors that are definitely pro this because there's so much information and real people's data coming out of this. And I think doctors should start turning their heads a bit, the ones that are super against it.
I agree. And then of course respiratory issues. So if you have asthma or something like that, like if you live in a place where it gets cold and you go out in the winter and it triggers respiratory issues, be aware of that. Or if you just have a hard time breathing anyway, you're very prone to hyperventilating. Uh, Obviously, once you get in, like most people do start to hyperventilate the first time until they learn how to get their breath under control. So it's advisable to start doing some sort of breath work before you start getting into cold therapy, just so that you can kind of have a better handle mentally on how you get your breathing under control. But again, this is where we go back to if it's your first time or you're concerned about it, make sure there's somebody there who can give you your inhaler or get you out or whatever it may be. Even we know somebody who gets in and like he's never affected no matter what, but even us, like sometimes we get in, our breath is like, oh, okay, that was actually cold, because we've just eaten, or like there's all kinds of variables of why like it feels more cold on some days than others. And so like even we get it where our breath will hitch a little bit. And that friend I was talking about, like sometimes he'll be like, oh, is it cold? And I'm like, I don't get you, bro, but whatever. But he's just trying to be funny. Um
That's an
so
amazing
it's normal.
That's an amazing thing about the breathing topic. I used to be somebody that suffered from asthma and allergies, but since I started my cold exposure practice and been consistent with it, my breathing has gotten a lot more under control and my allergies are almost non-existent. I don't know why, but um, I know asthma, it is a condition, but what I personally believe is asthma is really brought up from anxiety, because when you're anxious, you're not breathing properly. But I feel like since I've been doing my cold practice and I've learned how to take deep breaths daily, and the stress factor, taking deep breaths when I start to feel stressed at work or in my home life, wherever, like, to me, that's brought a lot of the handle on my asthma. And then allergies, I don't know, but honestly, cold exposure, I feel, has completely gotten rid of my pretty terrible allergies I used to have.
Oh, I wish I would do that for mine. I will say when I'm having a really bad allergy like day and I'm like super stuffy and whatnot, I can breathe when I'm in the ice bath a lot better.
Mhm.
And yeah, like your lungs, like anything else, are a muscle, right? So like my sister growing up had they diagnosed her with asthma, and really all it came down to was she needed to be more active. And once she started working out and like especially working out her lungs, like she didn't need the inhaler anymore. So
Mhm.
it's just like anything else, like you know, going running if you have asthma may be a no-go, especially if you're not working on building up that lung strength, but maybe doing the breath work and the ice bath will build up that lung strength, and then you can start running because of it if that's what you want to do, right? So there's all kinds of different things that it can help if done right.
So that's why I joined Ice Wellness Journal, because we got you with the cold exposure and then the small workout after, and journal about it. See if, like, if you're somebody struggling with asthma or anxiety or allergies, whatever, let's see if this actually works, because it works for some people. So why not give it a try if the medications aren't working anymore?
Yeah, I definitely wouldn't go so far as to say it works for everybody because, like anything else, I don't think it does. I'm sure there are people that should not be doing therapy, but it definitely works for a lot of people. And that's why it's so important that you have an individual assessment. And that's why if you're working with a medical doctor or even like a head doctor, a psychological professional, anything like that, it's super important you check with them because for some people, the physical release of the trauma that you're holding in your brain can be extremely scary because all of a sudden, you're in the ice bath and you're screaming or you're crying and you don't know why. And most people don't like feeling like they're not in control. So it's super important that no matter what your goal is with cold therapy, you are checking with any kind of medical professionals you're working with.
Yep, agree. And then proper hydration, nutrition, and rest can overall help your recovery and well-being with this practice. Um, like, make sure, especially hydration, that is the biggest one. um, with anything, but like, this is a challenging practice, especially if you haven't done it before and you really, really dislike the cold, like, and like Rose mentioned, it could trigger some mental emotions that's been pent up in there. And I'm all for it. We got to release and let that crap go so we can make room for the good stuff.
Yeah.
So take care of yourself and give yourself a lot of love after you do get out and do it. We can get back to work and go back to our days, but somebody else getting started, I recommend just doing it and then doing something you really enjoy after, and make it a nicer experience.
Yeah. I remember too, like it might make you tired, right? Because you are taxing your body. And so a lot of people, especially if you do the longer plunges, a lot of people do the longer plunges and then an hour later they're like, "Oh, I don't feel good." And it's like, "Well, you haven't eaten anything, you haven't drank anything. Like, of course you don't feel good. You just tax the heck out of your body." So if you're worried about that, gradual exposure, of course, is advisable. Do shorter durations, do half in, half out, whatever it looks like for you to gradually increase as your body starts to adapt.
Yeah, uh, adjust your practice accordingly to avoid effects. Like, if doing it in the morning doesn't work, try it in the afternoon or evening before bed. Just move it around. Don't let one, like I've had poor ice bath experiences, like, get in and it's just terrible the whole time, and get out and you're just like, oh, like totally upset. Like that was the worst
Yep.
session I've ever done for myself. But that doesn't mean I don't try it again. Just it didn't work that time. And I'm glad I know now. And it's typically when I eat too much before it, or if I'm really, really stressed out about things, it's just not for me to do my cold practice during those times.
Yeah, and that's one of the reasons that like our journal is not just a basic journal, because like, there's factors that people don't think about, which is exactly how long ago did I eat? What did I eat? Did I sleep well last night? Did I not sleep well last night? Did I ice bath last night and not sleep well when I did it? And so like there's lots of different variables that oftentimes we don't think about. Like for women, like where am I in my menstrual cycle? It sounds crazy, but for some people they get really sensitive before or during or even like directly after, or they're already in pain, so the pain is overwhelming the cold, and so the cold therapy they're able to do longer because it's bringing the pain down, and that's what they're focusing on versus the cold. So there's all kinds of different things that people just don't think about until they start tracking it.
Yeah.
Oh,
And
and then good.
oh no, go ahead.
I was gonna say, of course, balance it with medical advice, which I already talked about a little bit. Again, get different opinions, get allegorical evidence. Look into, you can do research on whatever it is that you have, or you can drop it in the comments anywhere, and I can do a Wellness Wednesday video on it. I'll put the research team onto it because they always look for actual articles that link to other studies. A lot of times they do find just allegorical articles, and if we do cover them, we do go ahead and point out that we're not sure where they're pulling their data from, but a lot of what we focus on is trying to make sure we're getting actual medical data. So the data is out there, just don't Google and click on the first thing you see. Make sure it's a reputable source and make sure that it links to how it got the data, or at least walks through the process of what the test was.
Yeah, there is several studies on health and showing both the benefits and the risks, but honestly, more research is needed for
Yeah.
conclusive guidelines. And that's why I love this community, because it's real people. We can read a lot of stuff online, but you don't know if it's that doctor that's totally against cold therapy and he's just putting stuff out there that may not be factual because he hasn't tried it or he hasn't studied it with his patients or what have you, and like just closed-minded to it. Like we know a lot of people in our lives that are really against it and look at us like we're crazy cuckoo, but we just have to and laugh because we understand the benefits it's done for us and the other people who are open to this practice. And that's why we are building this community, so we can continue to understand and learn. And there may be people in the community that say, no, this is terrible, but we need to know these things. So,
Yeah.
so
Yeah. It's kind of a problem because there's the big names in cold therapy, right? There's Wim Hof, there's Huberman. A fair amount of people obviously follow Joe Rogan and go off of like what he says. But there's a lot of other doctors, creators, whatnot out there who don't have as big of a following, but have way more insight and way more data and are doing the hard studies. And so I think that's the biggest problem is when people get into cold therapy, they research and, obviously Huberman's like the first thing that pops up, followed very quickly by Wim Hof. And so I'm not saying don't listen to them. I'm not saying they're wrong or anything like that. Like no hate to either of them. But it's just like anything else. If you're only listening to one or two people, you're not getting a full spectrum of the benefits. And so doing more research, reaching out across more creators, podcasters, doctors, things like that will obviously give you a more rounded vision of what cold therapy can be, because everyone approaches it differently. And then from there, you can really just start to tailor it to yourself. And that's kind of like what we strive to do, which is why all of our challenges come, like I said, with a new podcast to look at, or doctor to look into, because we want to make sure that we're helping people expand their knowledge of the cold therapy industry as a whole, as well as tailoring their practice to themselves.
Yep, exactly. No one track mind. We're all different.
Three-dimensional.
Mhm. So that's all.
Yeah, so that's about it, guys. Like I said, we are not doctors. Please do not take anything we say as medical advice. That goes for the Wellness Wednesday videos as well. They are designed just to help share the studies, share the science, and help you make informed decisions. So we are not telling you absolutely everybody needs to go jump into ice cold water, because we do understand that some people it's just not going to work for whatever reason. So always be safe, have a balanced approach, make sure you're hydrating, make sure you're not pushing yourself too hard, and again, seek medical advice if you really are concerned with a particular issue.
Yes, and join our community.
Yes.